This video will demonstrate the partial extraction of a mandibular canine tooth in a cat that has tooth resorption. And if you'll note on the radiograph, you can see that there's obliteration of the periodontal ligament space and replacement with bone going on in about the apical 1/3 of that tooth root. You cannot make out tooth root versus bone. So when we do a partial extraction, we want to eliminate anything but that. And if you look at that area in the pulp cavity that's enlarged, that could be granulation tissue inside of that. So this is a very similar radiograph to the tooth that we are going to be extracting here. And the approach is exactly the same as we would take to extract a normal mandibular canine tooth that's been affected by periodontal disease or fracture. It being normal meaning not tooth resorption. And so as we're progressing through here, we've made an envelope incision. We're not going to be doing any vertical releasing incisions here. We don't need to do that to extract the mandibular canine tooth. And again, this is exactly the same approach as we would take if this were not a tooth with tooth resorption. We want to be able to expose the bone. We want to get down to where you saw that differentiation between the tooth resorption portion of that apical 1/3 and the rest of the tooth. And visual observation will give us that determination on how far to go down, but we are actually going to be outlining the tooth root as we would normally during extraction, and extracting the portion that is still resorbing in the coronal 2/3 of that root. So as you see here, what we're doing is we're using our periosteal elevator to loosen the attached gingiva at the entire margin around that marginal bone. And then as we loosen part of that throughout that whole margin, we'll then start to work a little bit more aggressively to remove more tissue apical down to the middle foramen, which will expose, and then we'll take bone away from that with a burr down to that area. So right here where we're working, because of the resorption, there's a little bit of bone expansion there from periodontal disease as well. And so the tissue is a little bit more adherent to that area, and it's a little bit more difficult to elevate. So there's going to be a little bit of a ding in that gingiva, as you can see there, because of that, and that will be excised at the end of the procedure. That's not a big problem because it's a very small area. We can take care of that at the end when we're through. So right now we're working to get more exposure. We're working distal, and now we're working toward the mesial part of the attachment, trying to release that tissue. And then we can turn that periosteal elevator over once we've got reasonable exposure, and we can use the larger end. This is an EX9 feline periosteal elevator from Sislak, and we're using that large portion now to expose the majority of the bone after we've done our fine tuning. You can see there, once we pull that tissue back, that's the middle foramen just beneath that elevator. So you can kind of see how that bone is fimbriated at the edge. It's not normal, it's a little expanded. And so now what we'll do is we'll use our crosscut tapered Fisher burr, or 701L burr, to remove the vestibular bone. And you can see that tooth looks pretty normal at that point. So